This is a 65-year-old seropositive male with diagnosis of rheumatoid arthritis who's been treated with weekly methotrexate for approximately 2 years and is coming in to see his rheumatologist complaining of increased joint pain and increased morning stiffness. On physical exam, the patient has multiple tender and swollen joints and heat over the wrists and could not extend his elbows completely due to elbow swelling. The physician showed the patient his Vectra test result, which was 68, indicating very high molecular disease activity, and recommended that the patient consider adding a biologic drug to help reduce the chance of irreversible joint damage, which can occur when uncontrolled disease activity is allowed to continue. The patient was very reluctant to start biologic therapy because he had seen direct-to-consumer television ads showing that not only were the drugs useful to treat RA disease activity, but could put the patient at an increased risk of death due to malignancy, due to reactivation of things like tuberculosis. And on the basis of those concerns, was very reluctant to start the biologic therapy. The clinician explained to the patient that unless he reduced his disease activity, he would probably have irreversible joint damage, and that the Vectra test result would likely show an improvement with successful therapy. On the basis of that interaction, the patient agreed to start a biologic drug, and after 2 months of therapy returned with a much improved clinical exam and a reduction of his initially elevated Vectra to a moderate range after 2 months of therapy.